respiratory. Hi, Mr. Mark. My name is Amy and I'm a respiratory care student, and today we have been ordered to do an ABG on you. Now with an ABG, this is just kind of like taking blood, but we are taking it in your artery instead of your veins. So we'll be taking it from your wrist, okay? So before I begin, do you have any concerns or anything? Do you feel a little anxious about the needle or anything? Okay. So since you're a little anxious, I'll have somebody hold your arm. That way you don't jerk away from me when I take it, and that'll help me, okay? So before I begin, I'm going to take their vital signs and make sure they are okay and they're sitting up properly. And when they have their wrist out, I'm going to make sure like here, their wrist is going to be extended out and their hand is over it. So that way it gives me a good angle of feeling the artery and be able to do the Allen's test. So when I go and do this, so like say their hand is here, okay, before I begin I need to do the Allen's test. So I'm going to hold down the radial and ulnar on both sides, and I'm going to have them do 3 times, make a fist. And then if I get a positive Allen's test, then we are okay to do it on that hand, but if not, then I'm going to have to do the test on the other side, the other hand. So we like to take the blood from the non-dominant arm. So with the non-dominant arm, so I'm going to do it on this one. So I found the thing, and so I'm going to get ready. So I'm going to make sure my hands are clean again and apply the appropriate gloves on my hands. And I have the kit here, and when I open it, I'm going to prepare all my stuff. I have an alcohol prep wipe, I have the gauze to stop the bleeding, Band-Aid, and label, and then the biohazard bag for the sample, and then we're going to do the smallest needle. And so this is the smallest needle. So with this, I want to make sure it is at the appropriate setting here for when I grab the blood from them. In some cases you may have to do a little bit more, just so that way when they do the test they get the appropriate amount. So once I get that ready, I'm going to check again, make sure I find the pull through there. Okay, so once I find it, then I will remove my safety cap. And then I will have it at a 45-degree angle when I do this, okay? So then I will go in at a 45-degree angle, and then once I want to make sure, for me, I want to make sure my finger's out of the way so I don't poke myself. So once I go in, you'll notice the blood will start going into the tubing, and once you have it there, then you will make sure you apply pressure. So once you apply the pressure, sometimes you'll have to go up to 5 minutes, just depending on the patient. If they are on blood thinners, you'll have to go a little bit longer than normal. So you'll have to hold there, and sometimes you may have to hold there. And so once the bleeding is stopped, then you can put the Band-Aid on the patient's wound site there. And then the needle, with your needle beforehand, you need to stab it into here, and then that will push down your needle, and you'll dispose of the needle. And then once you dispose of the needle, then you will place this cap on it, to make sure to deliver it, okay? So once you deliver, you'll put it in your sample into here. When you have your sample in here, you want to make sure you have your label setting up at the top. Here you'll have your patient's names, the time you took the thing and the test, and the date. And then make sure you have the correct patient's name on there. And if you need to, you'll have to put it on ice if you have a little ways to go with it, or if you have to stay in the room longer than normal. And then once you get that, then you will assess the patient if they need any help. So you'll ask them if they need anything, if they're feeling okay, and make sure you assess their vital signs again to check to make sure everything is going okay for them. So once you're done with that, I'm going to wash my hands again before I leave the room and dispose of any gloves, blood, any of that.